not having a good day when you're talking to us, unfortunately.
Max Shireman likes to think of himself as a good man.
I have a good work ethic. I help out in my community. I volunteer for hospice in different areas.
But he also works as a project manager for Humana, the country's fourth largest health insurer in Louisville, Kentucky. And so it stung a bit when Nancy Pelosi recently called the health insurance industry villainous, citing its record of steep price hikes, denied claims, and generous executive pay.
There is no business in America that makes more money than the insurance industry.
It's very clear that we want a strong public option in the legislation. Insurance companies are out there in full force, carpet bombing, shock and awe, against a public option.
We are held hostage at any given moment by health insurance companies that deny coverage or drop coverage or charge fees that people can't afford at a time when they desperately need care. It's wrong.
In an ongoing effort to give voice to all sides of the healthcare debate, the New York Times recently asked Humana employees why they think their industry has gotten such heavy treatment.
Well, I think that we are kind of a faceless, impersonal, distant part of the equation.
And Harry Reid has talked about how you guys are quote-unquote the enemy. What's that make you feel when you're sitting at home and you see it on TV?
Very annoyed. To be called immoral or villainous, not so much. I don't care for that a whole lot. I've worked hard to be where I'm at. I came from a family with, very blue-collar auto workers. I got my master's.
Since 2004, Humana's revenues have more than doubled, thanks almost entirely to Medicare Advantage, a program that allows seniors to receive Medicare through private health insurers. The program has been criticized for its high administrative costs and would be slashed under the proposed legislation, leaving companies like Humana vulnerable.
Can I get a white with mixed cheese and chicken and sausage? I think the biggest concern is the public option. I know from my perspective, people talk about the administrative costs are so excessive in health insurance companies, and if we have a public option, it'll keep them honest and cut those administrative costs. But I am an administrative cost, and the reason the public option is able to get away with those would be able to get away with those low costs is if they took people like me out of the picture.
You hear the horror stories about individuals having coverage denied or major services not covered. When you see that CEOs are getting golden parachutes, those type of things, you really don't hear a lot about the good, you only hear about the bad.
Sometimes I would be outside just having a Frappuccino, and I would hear somebody come up and, just walking by and talking about these insurance companies, look at all this money they have, how do they afford to, they look at the building and they admire the building, and they say that this is their money. You will hear that kind of stuff from people on the streets. But it's pretty much a business.
I mean, the neighbors all say, when are you going to look for your next job? But, I'm staying the course.
I'll get teased by my friends for what I do, but then I'll make fun of them too, where a lot of those folks, they work over at Papa John's selling pizzas, so I just kind of laugh and say, well, you're putting people on the tables, we're just trying to fix them, so.